USA versus Spain, the shocking truth about healthcare you're not being told. Picture this, you're in pain, something's wrong, you rush to the hospital. In one country, you get help fast and you walk out with your dignity, your health, and your bank account intact. In the other, you're sent home with a $14,000 bill for a 3-hour emergency room visit and a bag of saline. This is the brutal reality of healthcare in America versus Spain. This isn't about politics, this is about survival, your health, your family's future. What if the country you lived in decided how long you lived? Not your genetics, not your habits, but your zip code. Today we're exposing the shocking differences between two Western nations. Both rich, both developed, but with healthcare systems that couldn't be more opposite. Stick around because the truth, it's going to change the way you think about getting sick. Part 1, the systems explained. Alright, let's start things off with the basics. What are we even comparing here? You've got the United States, home of cutting-edge medicine, the world's best funded hospitals, and some of the most complicated, expensive healthcare in existence. Then there's Spain, sun, siesta, and socialized medicine? Yup. Here, the government basically says, so you're a human being, right? Great! You get healthcare. No insurance card, no networks, just go to the doctor. In the US, you usually get healthcare through your job. That's if you have a job that offers it. If not, you're navigating the private insurance market, paying out of pocket, or hoping you qualify for Medicare or Medicaid, which are two government-run healthcare programs in the United States. Medicare is primarily for people 65 years old and older, whereas Medicaid is for low-income individuals and families. And even with insurance, you've got co-pays and deductibles and bills that can sneak up on you when you least expect them. Now in Spain, they have a single-payer system, publicly funded healthcare. It's like one big government-run healthcare plan for everybody. It's funded by taxes, but guess what? People actually use it without fearing what the bills are going to be. Doctors still trained, hospitals still running, people still getting the treatment they need without forking over their life savings. America's system is like ordering off the menu where all of the prices are hidden. Spain's more like an all-you-can-eat buffet already covered in the bill. The cost comparison. Now let's talk about something that really hits home. Money, specifically how much each of these two countries spends on healthcare. The United States spends about $12,000 per person on healthcare, whereas in Spain they spend about $3,600. The US spends 3 to 4 times on healthcare per person than Spain. 3 to 4 times! You'd think that Americans would be living longer, healthier lives, right? Yeah, no, they're not. More on that in a second. Let's compare real costs. Break your arm in the United States? You might have to pay around $2,500 for treatment, and that's with or without insurance. In Spain, yeah, it's covered. Childbirth in the United States? Get ready because the bill could be between $15,000 and $30,000 per patient without health insurance, or $3,500 with insurance. In Spain, it's either totally free or just a few hundred euros maximum. And no, that doesn't mean worse care. Wait, we're getting to that. For example, in the United States, insulin costs around $100 per vial without insurance, but considerably less with insurance. That's true. In Spain, it costs between $4 and $7. No, that's not an error. And where does all this US money go? Well, it goes to administration, insurance profits, marketing, billing departments the size of football fields, and don't forget those enormous salaries that are being paid to the CEOs of those pharmaceutical and healthcare companies. Meanwhile, in Spain, less red tape for the patient, fewer middlemen, and more direct care. Access and quality. Now maybe you're thinking, isn't the US getting much better healthcare for all that cash they're spending? Let's look at the data. The life expectancy in the United States is about 76 years, whereas in Spain it's about 83 years. Yeah, that's a 7-year difference. That's not small potatoes. Infant mortality rates. Prepare yourselves for this one. In the United States, babies are dying at a much higher rate than in Spain. Let that sink in. And access to care, that's a mixed bag. In the USA, sure, if you have great insurance, you can get fast access to specialists. And that's a big if. Plus, there's still paperwork, approvals, and networks to worry about. In Spain, most people can get in to see their family doctor within a few days to a week. Need a specialist? Well, that could take a few weeks or maybe months. But it's not because the system is broken, it's just designed differently. No one in Spain is being denied care because of their credit score. Oh, and no one's calling a billing office 6 times to find out why they were charged for 2 Tylenol and a Band-Aid. The shocking truth. Okay, now the part that hits the hardest. What happens when things go wrong? In the US, getting sick can bankrupt you, like literally. Studies show that over 60% of bankruptcies in America involve medical debt. Medical bankruptcy in Spain? No, it's not a thing. You won't find it in the vocabulary, because no one loses their home over a hospital stay. And here's a crazy stat. Over 100 million Americans are struggling with medical debt right now. That's nearly 1 in 3 people. In Spain, most people don't even think about not going to a doctor because they can't afford it, they just go. You can literally die in the United States because you don't have enough money to go to the emergency room. In Spain, that's not even a question, and thank God. Care first, paperwork later, or never. It's not perfect, no system is, but here's the deal. Fear isn't baked into the Spanish healthcare experience. In America, sometimes fear is the first symptom. Heaven forbid you get a serious illness in the United States without health insurance that might require months of treatment. Talk about adding more stress to an already terrible situation, knowing that you and your family might just lose your house over this. Anecdote time. In the last year, I had a medical procedure which required 1 pre-operation visit with a doctor, the operation itself, which required general anesthetic, and a 1-night hospital stay. And the next day before leaving, they gave me a delicious cocido madrileño, fantastic, and 1 post-operation visit a month later, I believe it was. And we weren't asked to pay a single euro for the entire thing. Now that's peace of mind. While it's true, in Spain, they don't often or ever have relaxing waiting rooms with modern furniture, magazines to read, comforting music, or television to watch the news while you're waiting. All of these things get added to your bill in one way or another in the United States. Culture and politics. So why are these 2 countries doing things so differently? Well, it's not just policy, it's philosophy. It's about what people think healthcare should be. In the US, there's this idea that if you work hard, you deserve good healthcare. And if you can't afford it, well, that's your problem. There's a huge distrust over anything that sounds like government healthcare. Think socialism, bureaucracies, taxes. And let's not forget the elephant in the room, insurance company and pharmaceutical giants. They spend millions every year lobbying to keep the system just the way it is. In Spain, over here, where I happily and healthily live now, healthcare is seen as a public good, like roads, police, and public education. You get it because you're alive, not because you've earned it. Doctors work for the state. Hospitals are public, and the system exists to serve people, not profits. So, while the US sees healthcare as a product you buy, Spain sees it as a right that you have. So, what does it all come down to? In Spain, getting sick is treated like an unfortunate event. In the US, it can feel like a moral failing, like you should have been richer, smarter, or more insured. Spain chose a system that says, we're all in this together. America, too often it says, you're on your own. And the hardest part, it's not just statistics. It's real people. People who die because they can't afford insulin. Parents skipping cancer treatments because they're afraid what it might cost. Veterans, students, working moms left behind by a system designed to profit, not to heal. But here's the good news. Systems can change, but only when enough people demand better. So now, ask yourself, which of these systems would you want when it's your mother in the emergency room, your partner, or your child? If this video opened your eyes, please smash the like button and share it with someone who needs to hear it. And please subscribe for more Spain and USA cultural comparisons, many of which are important elements in our lives. Because the next time you need healthcare, it shouldn't come down to your credit score. It should come down to your humanity. I'm your friendly neighborhood Madrid man saying ciao for now, hasta la próxima, and thank you for watching. Be well, stay safe, and happy and healthy.